Your doctor has ordered enteral nutrition, also called tube feeding, that will be administered through your feeding tube. This educational video will provide you with step-by-step instructions on how to administer your tube feeding effectively and safely. It is important to clean your hands to prevent infection. Clean hands thoroughly using soap and warm water, rubbing hands for at least 20 seconds, followed by drying hands with a clean towel. If soap and water is not available, use an alcohol-based hand sanitizer. Prior to preparing your tube feeding, select an uncluttered work area. Clean the work area with warm, soapy water or antimicrobial cleaning agent. Gather all formula and supplies needed for the tube feeding. Locate the tube feeding order included in the delivery. Check the expiration date on the formula carton. Make sure the name on the formula label matches the tube feeding order. Unopened formula can be stored at room temperature until the expiration date. Formula may come as a powder or liquid. Powdered formula should be mixed per manufacturer instruction, unless otherwise directed by your doctor. Once formula is mixed, it must be kept refrigerated until ready to use. Mixed formula should be covered and stored in the refrigerator for up to 24 hours. Throw away any unused portion after 24 hours. If using liquid formula, wipe off the top of the container with a clean cloth and shake well before opening. Liquid formula should be covered and stored in the refrigerator after opening for up to 24 hours. Throw away any unused portion after 24 hours. Open cartons of liquid formula or mixed powder formula should be covered and stored in the refrigerator for up to 24 hours or per manufacturer guidelines, and can stay at room temperature for no more than 4 hours for mixed formula or human milk, or 12 hours for ready-to-use liquid formulas. Your doctor has ordered your tube feeding to be given with a syringe. For this feeding administration, you will need tube feeding order, towel, syringe, lukewarm water for flushing, formula ready to use. Prior to administration, sit in an upright position, or if in bed, elevate the head of the bed at least 30 to 45 degrees. Do not lay flat during the feeding and for at least 1 hour afterwards. Place the towel on lap as formula may spill during administration. Flushing with water keeps your tube free from clogging and ensures daily fluid needs are met. Water flush requirements will be listed on your tube feeding order. Feeding tubes should be flushed with water before and after feedings as indicated on the tube feeding order. If giving medications through the feeding tube, flush the tube with water before and after administering each medication. Draw up water from container using a syringe. The amount required will be on the tube feeding order. If the feeding tube has a clamp, make sure it is in the closed position before opening the cap of the feeding tube. If the feeding tube does not have a clamp, pinch the tubing before opening the end. Open the cap at the end of the feeding tube. Attach the syringe to the feeding tube. The feeding tube may have a twist and lock connection or a cone tip connection. If the feeding tube has a clamp, make sure it is in the open position. If the feeding tube does not have a clamp, unpinch the tubing at this time. Push plunger on syringe to slowly administer water flush. After flushing, clamp or pinch the feeding tube before removing the syringe. Once removed from the feeding tube, pull the plunger out of the syringe and set it aside. Connect the syringe to the feeding tube without the plunger, ensuring a secure connection. Slowly pour the contents of the prescribed amount of formula into the syringe. Once the feeding is complete, close the clamp on the feeding tube or pinch the feeding tube if no clamp is present. Disconnect the syringe from the feeding tube and flush the feeding tube with water if prescribed on your tube feeding order. Close the cap at the end of the feeding tube. Wash syringes with warm soapy water, not hot. Rinse thoroughly and allow to air dry. Syringes should not be put in the dishwasher. Syringes are reusable for a 7-day period. Tips for successful administration of your enteral feedings. Do not put anything other than formula, water, or medication ordered by your doctor through your feeding tube. If you experience diarrhea, constipation, nausea, vomiting, or other significant complications after initiating your tube feeding, it is important to notify your doctor. You may experience changes in bowel function, such as frequency, consistency, and appearance, as a result of tube feeding. These changes should resolve in a few days once you become accustomed to the formula. If changes continue for more than 3 to 5 days, notify your doctor. Guidelines for refills. Your first delivery of formula and feeding supplies typically consists of a 3 to 7 day supply. This may require a signature upon delivery. The remainder of the 30-day supply will be delivered by UPS and should be received within a few days. Option Care Health must communicate with you prior to setting up each monthly delivery. Scheduling automatic delivery is not possible. Your initial paperwork will include the phone number for refills. Please store this number in your phone or keep it in a safe place. If you are down to 3 to 5 days of formula or supplies, please contact us to avoid running out. It is important to maintain monthly contact with your Option Care Health team even if you do not need a delivery. Thank you for watching this instructional video. You've now viewed how to successfully administer your tube feeding by Bolus method. With each administration of your feeding, you will get more comfortable with supplies and steps needed to complete your feeding. Please notify your doctor if redness, leakage, swelling, or pain occurs around your tube or any other complications. For any questions or concerns you might have, please contact our highly trained multidisciplinary team of dietitians, pharmacists, and nurses. We are available to you 24/7, 365 days. Please contact Option Care Health at the number provided in your paperwork.